I wanted to take a minute to talk about carpal tunnel syndrome, what it is, the symptoms involved, and what you can do about it. A lot of people come into my office complaining about carpal tunnel syndrome, and they point to many different things when asked where their symptoms are. They point to the back of their arm, they point to their pinky, and they point to the back of their hand, which none of these symptoms are related to carpal tunnel syndrome. Carpal tunnel syndrome is a compression of the median nerve. The median nerve runs down the forearm here in the, not the back side of the arm, but the flexor side of the arm into the carpal tunnel, which is here. This is the carpal tunnel. The carpal tunnel is made up of a ligament that runs like this, and then the flexor tendons underneath, and that nerve travels through that tunnel. When the median nerve is compressed in this area, you have classic carpal tunnel syndrome. Median nerve compression will give you a neurological symptoms along the distribution of the median nerve, which is the thumb, the index finger, the middle finger, and the half of the ring finger. If you're having symptoms that are in the pinky or the back of the hand, this is an ulnar nerve compression or a radial nerve compression. These are also serious issues that need to be addressed, but they're not carpal tunnel syndrome symptoms. If you're having median nerve compression, the first thing you need to do is figure out where the median nerve is getting compressed. In our office, we use ultrasound imaging to actually use sound waves, just like when they look at your baby. We use sound waves to get in and image the median nerve and see where is it getting compressed. We can see where it's getting compressed because when it gets compressed, what you'll have is a backup of fluid, and that nerve will actually indent and then get inflamed right after the area where it's being compressed. So we can easily see on the ultrasound where it's getting compressed. The big problem with carpal tunnel syndrome treatment is that the surgeries are being done in the carpal tunnel here. They're cutting and they're cutting in there and they're opening up that tunnel, and that's working about half the time. The issue is another half of the time the median nerve is being compressed along other parts of its pathway or distribution. Most commonly, the median nerve gets compressed in the pronator teres muscle, which is here. So you've got this muscle that's going like this, and the nerve is coming down through like this. When this muscle is tight and overworked from a lot of computer use, this nerve gets compressed, the median nerve gets compressed under the pronator teres, causing carpal tunnel syndrome. And if you cut into the carpal tunnel here, it's not going to do anything for the issue up here. What we can do for this up here, we don't need to operate. What we need to do is break up the scar tissue in the forearm. Once we break up that scar tissue, we need to take the nerve and we need to floss it back and forth while we pin the muscles down. So we get this action like this where we're unsticking the nerve from the surrounding tissues. We can easily treat carpal tunnel syndrome. It doesn't take a lot of visits, it doesn't cost a lot of money, and it doesn't require risky, invasive surgery. And we can do it easily because of the use of ultrasound imaging and the use of active release techniques. So I hope this answered some of the questions you have about carpal tunnel syndrome and what can be done about it. Click below for more information about our office, and I'll also put a link to some of the testimonial videos that some of the patients have put up on our website about carpal tunnel syndrome and their experiences with our office.